Google. So anybody who just open Google and write RCOG, MRCOG-1 exam, how to book MRCOG-1 exam, he can just follow this information. So this is the eligibility form. This is the eligibility form. It is very easy to fill in. And alongside this eligibility form, you will send your medical degree. Okay. What is the processing time? Because a lot of students, they got panic when they take more than 1 or 2 weeks. Actually, they reply in a time period of 4 weeks, and sometimes it takes more than that. Okay, somebody has the video camera open. If you can just turn it off. All right. So please allow up. RCOG is saying that please allow up to 4 weeks after the published closing date for your Part 1 eligibility application to be processed. If approved, you will be then eligible to book a place on the Part 1 MRCOG exam. So before Part 1, this eligibility thing is very, very important. It is not possible for the RCOG to accept late application. So you have to follow the deadlines. And I have told you the deadline is already closed for the eligibility of January exam, and that was Friday 30 September. So now we will talk about the expression of interest thing. So this is the expression of interest form, which is available for everyone on the RCOG website. You can see you have to enter the college number, you have to enter the email address by which you have made your account. You will keep your email address same every time you enter your information. First name and surname, and then you will send your expression of interest. One thing which is very important to consider, that they will not send you any reply email, any response email for expression of interest, but they will send an automatic response for the eligibility. Okay, they will send an automatic response for the eligibility. Okay, from the chat box, a doctor is asking, do we have centers in Lahore? Yes, we have centers in Lahore. Why not? Yes, we have centers in Islamabad. Peshawar, I will confirm, but I guess all the major cities in Pakistan have the centers. And I will convert the fees. I will update you about the fees. Or else, Mafia, yes, you are in the session. Welcome. Firstly, Mafia is our team member from the admin team. She is the head of our admin team for MRCOG-1. So, Mafia, if you please just convert the pounds into Pakistan rupee and just tell the student how much money she is going to submit to RCOG tomorrow.
Yeah, hi
Okay.
everyone.
Now comes the
Yeah,
hello,
thank you so very
Mafia.
much for the warm welcome, Dr. Mehwish. So definitely, I'll just help them out. Once you will finish, I'm just reading their queries. I will answer them all at once. Okay. Thank you.
Okay. Okay, great. I'm also trying to cover the queries between the slides, but somehow it is interrupting the flow of the session. So it would be great if we can
No
answer all the
issues.
queries
Yeah, I'm
after the
here.
session. Yes.
Okay, okay.
Thank
Thank you.
you. So now we can see that expression of interest thing is very important. And if you haven't sent this expression of interest, you cannot take the exam. So candidates must submit a completed expression of interest form before the deadline. Okay, this is also an important thing. Now comes the booking thing. Okay, we were talking about these steps. All 3 steps are done for all the January candidates who are in our group, because the team, the admin team, and I myself keep on giving the reminders for these deadlines. So all 3 steps are done for the med exam students, and I hope all the students who are going to take the exam. So next comes the 4th step, booking a place. So what place you will book and how you will book. Again, everything is given, all the information is given on the website. So candidates who have approved eligibility and have submitted an expression of interest form will receive a booking token. How they are going to receive a booking token? They will receive it through an email. Okay, and probably they will be receiving the email. What UK time? Yes, Dr. Chaman, the recording will be available Actually, I can't predict what UK time they will send the email. I talked to admin team about it. If we get any update about it, we will tell you the time also. But students, I would say that let me make Dr. Amani talk about it. Dr. Amani, you have taken the exam in September, and you have recently booked the exam, and you know very well what were the steps you followed. So, will you please just turn on your mic, and will you please guide the students that when you received the booking email, what were the next steps which you followed? Is Dr. Amani here with us? Okay, Dr. Manisha is with us, and she is also our September candidate. Dr. Manisha, would you like to speak about the booking process after you got an email? What were the steps which you followed, and how was the booking process for you?
For me, the booking process was easy. It wasn't hard. I think all the instructions were on the site. As well as I think they sent a confirmation to just double check all information in which you've entered before, and after that it was pretty straightforward. That was basic.
Pretty straightforward. That's what I wanted to hear. That booking process is pretty straightforward. If you just follow the instructions and you just don't panic after getting the email, if you just follow the instruction given in the email, the booking is quite easy. So now comes the person view part. Now comes the person view part. Okay, Dr. Amani, and you are taking exam in 2023. Actually, I was hoping that yes, okay, I got it. I was talking about another Dr. Amani who took the exam in September. So your full name was not in front of me. That's why I was confused. Okay. So booking into the person view center. Again, we will read what RCOG is saying. Candidates booked into a country location will be contacted to schedule a slot in one of the person views test centers. Okay. They will contact you themselves. They will not just leave you in a trouble that a candidate is trying to book the exam and a candidate is not able to book the exam. They will help you in every step. Okay. So candidates are only permitted to book into person view center in the country location they have chosen, booked, and paid for. So firstly, you will provide your address. Firstly, you will provide your address, and you will select a center which will suit you. And then person
हाँ जी
view will contact you.
खाने टाइम हो गया
Then the person view will contact you, and they will make you enter into their bookings. Okay. Now, what I'm going to give you is a good news that our MedExam expert customer support team is 24 hours available with you, and this is the number. You can note it down, and the number is also available in the chat box. Dr. Ruhi, I have not the recent information about it, but that's probably the office time, the office UK time. Any documents needed for booking? No, you only need your card. Okay. When will we get the email? The office time, the UK office time is the most probable time for this thing. You don't need any documents with you. So you can note down this number, which is right in front of your screen. Why I'm giving you this number? Because at any step, you need any guidance. You can talk to Mafia, you can talk to Yaver, you can talk to Fatma. All the members are very actively answering the queries of the students, and don't feel lonely, don't feel sad, don't feel bad, don't feel any negative thing while booking, because booking is not as difficult as you are thinking. Exam center available in Faisalabad. Dr. Zishan, you can give your home address as Faisalabad, and person view will contact you. If I say yes, available, and they have made some changes, so I don't want to give you any false hope about it. But I know that in all the major cities, they are going to take the examination. Okay, but every time they take the examination, there are some changes, and I have not the updates for the coming day. Okay. Thank you. So what are the important things for you to know? That you are now in a good relationship with RCOG. So keep checking their website. Okay. Just keep checking their website, and as many times you open their website, as many times, it will be easy for you to understand and follow what they have written. Okay. So keep checking the deadlines from the official website. And also you can take help from MedExam team, because we also keep on updating students about it. And do not think that booking is a difficult process. As Manisha has told you, that the booking process was very straightforward and it was very easy to follow the steps. Then the card thing is very important, because sometimes a card is declined and student is very anxious about the payment. There is a query I have to answer. They sent me a survey link asking if I want to sit for exam, but I didn't fill the expression of interest. Dr. Hiba, okay, you can just send an email to RCOG by saying that you forgot to send the expression of interest, and let's see what is their response, and if they allow you to sit in the exam without sending an expression of interest or not. But on the website, it's very clear that you have to follow a deadline. Okay. What will be the Pakistan time? Dr. Zishan, they have not given any time limit for sending the booking email, but it's most probably the UK office time. Okay, Dr. Fakhra Ijaz, I guess so. F Ijaz is Fakhra Ijaz, because you are one of our students and I cram the names of the students very easily. Yes, this is a very important question to know about. Are the booking slots limited? For some countries, yes. For some countries, the booking slots are really limited, and the students from those countries, they have to book the exam quickly. But in Pakistan and in UK and in some other countries like India, and there are no limited slots, and they can book the exam in the limit which they have given. Okay. So there is a thing about the card. If your card is declined, the booking process is, difficult for you. And what I would say, that use a card which you have already used for international transactions. First thing. Second thing, connect to your bank today and ask about the validity of your card. And the third thing, that enter the number of your card correctly. Okay, while you are entering the number of the card, it should be correct. If you enter a wrong card number, probably in the second attempt they will block the booking process. And if you get any difficulty while booking, any difficulty, you can just talk to MedExam team and they will help you. Can we book Pakistan seat from UK? Dr. Aisha, yes, you can. The address you will provide them for booking the exam, they will give you the person you center for that address only. Okay. Will they accept credit card from Pakistan, as last time they were not accepting direct payments from the Pakistan? Yes, for Pakistani card, there are problems. So that is why I'm saying that try using a card which is valid for international transaction. And there are different banks, and you can just call to your bank and you can talk about your card, if it is valid for your payment or not. Dr. Ikra Akhtar is asking, booking slots are limited or not? I would say for Pakistan, no. In Pakistan, I haven't seen uh, this booking difficult for the candidates. The seats got consumpted very quickly for some countries, but not for Pakistan. Yes, for UAE seats are limited, but as I have told you that every year they are improving and they are increasing the number of person view center. So I would just say that follow the dates. The booking will be start from tomorrow. So try booking a place on 10th November. Can I send fees through my cousin's credit card? He is in Ireland. Yes, Dr. Nazia, you can. I'm saying that try using an international card for the payment. It is less likely that they would decline an international card. Okay. Not sure if the same overseas, but as for UK, a heads up that during the break time, you will not be able to use any of your notes, books, or phone. You are talking about the exam, the break between two parts of the exam. Yes, if they are allowing you to see the books or using if they are allowing you to use the phone, it's likely that you will send the questions to your friends which you have done in the part one. So it's good if they are not if they are not allowing you to use the books and notes and fonts, but you will be allowed to eat something, I'm sure. So that would be only thing you would need at that time. Dr. Tasneem is saying, I'm from Bangladesh. Which time is appropriate for starting process? I mean, which time is appropriate match with UK time? Okay, team will answer your query right after the end of this webinar. We are looking for the suitable timing from UK, and they will update you about it. Doctor, I would say that you just keep checking your emails, and when you receive an email, just try to book the exam at that time. Dr. Iram, they have promised to send the emails. Actually, they have not promised, they have given the date 10th November. So before that, it is less likely that you receive the payment, the booking email. Yes, Dr. Somia, I have seen students having difficulty from Malaysia, and that the seats were limited and they couldn't book the exam. Dr. Luzine is on to something. She is saying that if somebody has got the paper one, he should share. Actually, Dr. Luzine, at that time, you are not into just sending the questions to anyone. At that time, I just want students to eat something to balance the glucose levels and just take some rest. Use the restroom, wash your face, wash your hands, wash your neck, and just after this 30 minutes of break, just go for part two. It's really not advisable to go and read some topics and go through the books or send the questions to anyone. And for that 30 minutes, I don't think you want to talk to family or friends. Just make yourself prepare for the next part of the exam. You will be paying, Dr. Sumaira Hamid, you will be paying to RCOG, not the person view. Person view is only about booking a slot. Dr. Farzana, you will not receive the Dr. Mustafa is saying something, payment is done on person view. Dr. Mustafa, if you please turn on your mic and explain this, because I knew that payment is done to RCOG and person view is the center for booking the slot. So if you can just explain your point, it would be good. Yeah, no calculators allowed.
Assalamualaikum, ma'am. Actually,
Hello, Assalamualaikum, Walaikum Assalam. Ji.
recently, RCOG has changed quite a few things, in which
Okay.
after we receive our booking email from the RCOG, that is approximately a month before the exam.
Okay.
They give a specific link to the Pearson View website for us to make a new account on Pearson View in the RCOG specific portal. They have that
Yes, okay.
specific RCOG portal that is different from the one which you make on your website.
Okay, okay.
So you have to create a new account with the same email you have given to RCOG while applying for the eligibility form and for the expression of interest. After that, you create, RCOG has already booked a place for the specific date you're appearing in the exam. So you just have to follow some few instructions, which is present on that portal. And you have to just pay and reserve your seat. That's all. It's not that difficult.
Okay. Dr.
Yeah.
Mustafa, but I have understood that RCOG will send you an email tomorrow to the candidates.
Yes.
Okay. Then you will open that email and you will make another account on the person view. And after
Yes.
making that account, you will be paying and you will be booking the slot.
Yes.
So actually it's RCOG, right?
Yes, ma'am. Yes, ma'am. It's
Actually,
RCOG
it's RCOG, yes.
just being organized by Pearson VUE.
Person View, yes, because they
Yeah.
have collaborated for the computer-based examination with Person View. Okay, so it's actually not the headache for the students to whom they are paying. They should just know that they have to follow the steps, and when there is a time for the payment, they will just enter the card number. Okay.
Yes.
Dr. Gulwish is saying, I have not received any email yet. When should I expect to receive a booking email according to Pakistan time? According to Pakistan time, you can link up your time with the UK timings, and in UK office timing, you will receive the email. But the exact timing of sending this email is not given by RCOG yet. Yes, booking a place and payment can be done at the same time. Dr. Mustafa can tell you more about it. Dr. Shaban is asking if booking a place and payment will be on the same day. Dr. Mustafa, what
Yes,
do you
you
say?
have to.
Yes.
Yes, thank you so much, ma'am. Yes, you have to select the obviously the venue yourself, but the date is same for all the candidates around the world. Whether it's your January attempt or your July attempt, RCOG has clearly mentioned it on their website. For example, I think the January attempt is on 23rd of January, ma'am.
It's 16th January.
16 January. So you'll already have an icon showing 16th January on your Pearson VUE calendar when you'll be paying for your seat. All you have to do is pay and select which venue or which test center you want to give in your specific area. That's all. Otherwise, there's
That's all.
no, yes, that's all.
One thing I've seen, Dr. Mustafa, Dr. Manisha, you can also take part in this discussion. One thing I've seen is that students keep on clicking the same link again and again, and the link got stuck and they cannot use the website after that. And then they have to restart everything, and this makes them quite anxious. So, what do you think, Dr. Mustafa? It's a
Um,
good thing to do or not?
no, actually, ma'am, it doesn't happen quite often. But the thing is, okay, when they send a link, you have to wait a
Mhm.
couple of hours, and then you should try an attempt to create an account. That would be much better.
Okay,
Because I also
that would
faced
be
the
better.
same issue along with other
Hmm.
candidates. When remember, ma'am, when we were applying for the exam, we had an issue like that. But after a few hours, I tried again, and it was very easily booked.
Okay, okay.
Yes.
So someone is asking a question.
How to make the
Okay.
person you come? They will purely guide you. They will send you an email with the PDF of I think 10 pages, step-by-step
Hmm.
guide. It's very easy. All you have to do is just put in your email and create and put in a password which you think is appropriate. That's all. Hardly
Okay,
takes
Dr.
5 minutes.
Gulwish, as Dr. Mustafa has said that they will guide you in every step. They will guide you how to book a place from Person Viewer and how to make an account and how to go for the payment. Okay. And will they ask for the identification of the card? Dr. Ruhi, but I guess from your question, you are asking if you are the owner of card or not. It's not necessarily, it's not necessary that you should be an owner of the card if you are paying from that card. So if it is your question, and this is the answer. If you are asking something else, please write something clearly. Okay, we are at the point number 4. I would say that use an internet with a very good speed. Okay, so that the booking process just don't get stuck and it's smooth for you. Take help from the med exam team. I've told you that every member of the team is available with you. Do not click the links again and again, as Dr. Mustafa has told you, to wait for like 3 to 4 hours. Um, just do not click the links again and again. So the next part of our session is innovation of the uterus. Why I have put this topic right after the discussion of the booking, because I want you to take the exam very seriously now. So this is a difficult topic, so I thought that I should make it very easy for you to understand, because And now in very quick steps, we will cover these topics, and I hope this will be easy for you. Can link be
There are
open
some
many times?
queries. Yeah.
Yes.
Yeah, Dr.
Dr.
Mehwish, I just
Nadia?
want to ask one thing.
Yes,
Yeah.
please.
Before you will start your topic, I just wanted to tell them about the progressive course once if they have booked their exams, so how they're gonna proceed further. And before that, we have some questions in the chat box. You may answer those. Then after that, I'll proceed.
Okay, okay. Can we book exam from mobile or use laptop for that? I would suggest a laptop would be good thing, because on mobile uploading a heavy website is difficult. Laptop would be good thing. And can link be open many times? I don't understand this question actually. If you are asking that link is just one time thing to be used, no, you can open the link anytime you want to book the exam. Is this what you were asking? I guess so. Okay, I guess a lot of queries from the students have been cleared now, and now everyone who is going to take the MRCOG exam is ready for the booking. Dr. Vala, sorry, I missed your question. Actually, I have answered this question in the session already. If you have missed the deadline for eligibility, it is very unlikely that they allow you to sit in the exam. You have to wait for the next attempt, which is in July now. And this time, I would say just keep
Yeah.
on checking the official website for the deadlines so that you don't miss the deadline for the eligibility. Dr. Anam, I can't tell you the exact time, but UK office time is most probable time for which they send you the email of booking. And Dr. Vala, good luck for the July preparation. We have started the preparations for July exams already, and students are joining our study groups. So if you have made your mind for taking the July exam, just go for it and just take the help from the med exam during your preparation, and you will be very happy at your result day. Okay, Dr. Mafia, will you please say something about the progressive course for the January batch, please?
Yeah, sure thing. Okay, I have to share my screen first, so will you please allow me that? Can I please?
Please, yes, please.
Thank you. So my screen is visible to all of you? Yeah. Dr. Mehwish, can you see my screen?
Yes, I can.
Okay. Thank you. So basically, we have on the request of students, we have prepare, and you can see that we have launched a course name with the progressive course. Basically, it's a revision course, and you all know that revision is very important to wrap up your all the preparation, because without revision, you cannot sit in the exam. So for that, we have designed a course. So the name of the course is the progressive course. So what you have to do is we have recorded lectures of all the modules. I have explained this before as well, because we are receiving from last couple of days, we are receiving a lot of queries regarding the revision course. So our mentor panel designed this course for only those students who are just preparing for the January exam. So what we are going to do is we have some recorded lectures. These lectures are from our regular course, and they are explained in a very detailed. And we have the study groups in which all the queries of the students are answered as well. We have some students in the session who have joined a regular course as well. They can guide you very well, that and they can share their experience with you as well. So in this course, you will get all the recorded lectures of the modules. For example, if you have anatomy, pharmacology, and other subjects, we have the recordings of all these subjects. What you have to do is, for example, you are just revising 3 of the subjects for 1 week. Let's say it's pharmacology, anatomy, or biochemistry. So once you will revise all these lectures from our website, and once you're done with the lectures, you will go on the website again, and then you will give some topic test. Topic test means that we have some MCQs or SBAs relevant to those particular subjects. We have separate MCQs or SBAs regarding to every subject. For example, we have SBAs of pharmacology, then biochemistry, anatomy, and one by one all the subjects. So once you are done with your recorded lectures, you have to solve your topic test. And once you are done with all the subjects, and you can read your flashcards as well. After that, we have a live session of those revision on those particular subjects. If you have any query, you can ask in the study group from your mentor, or if you think that you're still facing any issue, you can ask those particular you can say that queries from in the live session from your mentors. Mentors will help you in revising all those modules as well. For those students who haven't taken any course or you haven't started studying yet, they can also join the session because we have recorded lectures for those students as well. So once you are done with all the sessions, like all the recorded lectures, you have done with the topic test and you have revised it one by one, all the subjects with your mentors, you can go to the website again. Then you have to solve the mock exam. It's named with the big mock. And once you are done with the big mock, what you have to do is we will have a workshop. It's the workshop of recalls. You can solve all the recalls with your mentors as well. So after the recalls, we will again do a mock exam. So basically there will be 2 mock exam. So once you're done with that mock exam as well, your mentors will be with you till your day of the exam. If you still have any query, your mentors are with you. So for now, for all the students who have attended this webinar, we have 50% off for 24 hours. And for all those students who are our course students, they can get the progressive course in 50% off. Whereas the students who are like new students, they are not in the course, not in the webinar, they can get the course but on 30% off. And exclusively, it's for 24 hours only. Okay. So if you have any question now, you can ask me. So yeah, the price is mentioned already in the poster. Yeah, my team member Fatma will help you in getting the course as well. Yeah, after discount, you can get it in $75 for the course students. You're welcome. Any other query, please? And yeah, one more thing, by tomorrow, on the day of booking, our backend team, Fatma, then we have Miss Muhira and Yavar. They will be with you as well for if you face any difficulty during the booking of the exam, they will be there to help you out. Okay.
Okay, Mafia, I want you to share the schedule of the progressive course as well, so I can explain it a bit.
Yeah, sure. Why not?
I tried to download it and show it on my screen, but I have shown the PDF file, so I cannot show it
Just give
from
me
my computer. Yes,
yeah,
please.
sure thing. Just give me a second. I'll share it out. Amira, yeah, you can just give it. Just Fatma, can you please help the Amira? She wanted to book the exam, but she wanted to delay it, I guess. Yeah, Fatma and Muhira, can you please share your contact number and help them out? Thank you. Yeah, thank you, Fatma. Okay, Dr. Mehwish, just
Okay,
give me a second. I'm just sharing
I
the
can show
screen.
I can show the schedule. I can show the schedule.
Okay, that's very great.
So, students, what Mafia was talking about, three subjects in a week. So this is a very good plan, and it covers everything. You know, you can see this physiology, endocrinology, and embryology in the bundle 1 or the week 1, then microbiology and stats, then anatomy, genetics, and biochemistry, then pathology, immunology, then pharma and clinical management. And clinical management also covers the data interpretation and which is the biophysics. So all the modules are covered in this time. It will be start from the 20th of the November. So after that, but you will get the 5 days workshop, and it's a complete revision plan. What happens? You are studying for the exam from 3 to 4 months, but the timing of revision is very important. Why timing of revision is so important? That you study for the exam, but what happens if you miss anything important right before the exam? You don't revise it, and you have covered it like 3 to 4 months before. So you will just forget it during the examination. So 1 month or 1.5 months before the exam, that preparation is so much important that I can tell you what is the importance of this course. So just take it. Team is helping you in getting the discount as well. and you will be a part of a very active group, and you will be getting the recording, also the detailed ones, and then you will be getting the live sessions which are question oriented. Question oriented sessions are important to take. Why? Because you are solving the questions in the exam, not the theory part. So what questions they can ask in the exam, and what can be the answers. So this will be the main context of this progressive course. What to do for 5 days MCQs workshop only? Okay, Mafe is guiding you. You can take the workshop only if you want. If you don't want to take the progressive course, the 5 days workshop will give you the revision of all the important points also, because we cover 1,000 questions in that. 1,000 questions mean 1,000 important topics for the exam, and it covers most recent past papers also.
Yeah,
Okay.
they can, Dr. Mehwish, they can check the reviews of the past workshop as well on our page, because
Yes.
from the September batch, we got the feedback that 70% and 75, I guess, percent questions are from those workshop, right? We have
Yes, they said
reviews on our
that
page.
60% paper were they
Yeah,
asked question from the
yeah, I
workshop.
have some
Actually, I'm not
reviews.
saying that I am the one who is leaking the RCOG paper. Actually, I
Yeah,
make the students prepare all the important topics, and definitely important topics. They repeat the important topics in the exam. So
exactly.
you are going to cover all the important topics before the exam. What students do, they just sit in their homes and they keep on doing the unnecessary things. They do a lot of unnecessary things right before exam, because of the fear of the exam. They think that they will ask this question, and actually they just make the 80% part of the paper from the important things only. Okay.
Yeah,
uh
exactly.
dr Dr. Minali is saying that she has missed the booking part. Okay, you will get the recording of this session, doctor.
Yes,
And there was a
exactly.
query that somebody was saying that her cousin is going to pay from the island. Yes, it's possible. Dr. Nazia was asking this. Yes, it's possible. Any person can book the exam for you. Actually, MedExam team was the one who was booking the exam for and September candidates. So if you are unable to book the exam, you can ask our team to help you in this. Yes, another query. I guess we're not making time for the educational topic today. What is the fee for booking MRCOG? Okay, 508 pounds Mafia has shared, and you can convert the pounds into Pakistani money. Do we have center in where?
Yeah, there was a weird question. Maldives. It's Maldives.
Okay, it's Maldives. So I have to confirm from the website, because there
Yeah.
is the list of all the countries
Actually,
in which they
for
take
the
the exam.
exactly, Dr. Mavish, I just wanted to add one point in it, that you have to keep your I just suggest a few of tips, that you must your internet connection should be very strong during the booking. Your credit cards, at least you must have two credit cards if there are some issue, because sometimes all the seats are being booked and few students are left with they just regret that one card is not working, so we have to take someone else card, and meanwhile all the seats were being booked. So please keep it two cards at least with you, and a strong internet connection while booking for the seats, right?
Yes, good. And now Fatma has shared some important points for only those students
Yeah.
from the countries in which the slots are limited, because in the countries in which slots are not limited, they don't have to do this hustle. And if they can secure the exam in the booking window, which RCOG has provided. But if the slots are limited in your country, just follow the steps Fatma has written in the chat box.
Yeah, exactly.
Okay, so now we will move to the anatomy of the uterus. You can see right in front of you. And if you still have queries about the topic which we have finished, you can just drop your queries in the chat box, and team is here to answer. So we know
Yeah.
very well that the genital tract of the females is consisting of the fallopian tubes, ovaries, uterus, cervix, and vagina. So today we are going to talk about the innervation of the uterus. So we know what uterus is made up of. Uterus is made up of smooth muscles, right? So uterus is getting the innervation from this is the table right in front of you. You can see that there are plexuses coming from the spinal cord which are taking part in the innervation of the uterus. So T10, T11, T12, and L1 are the spinal segments which are making up superior hypogastric plexus, which take part in the innervation of the uterus. It gives the branches to the ovarian plexus. Then it divides into right and left hypogastric nerves. Right and left hypogastric nerves, they then join the inferior hypogastric plexus or the pelvic plexus. And they are coming from S2, 3, and S4 segments of the sacral plexus from the spinal cords. Then the fibers divide and accompany internal iliac artery. The root is the same as the internal iliac artery. Then they supply the vesicle or the bladder and the uterovaginal, and the branches into the uterus. Branches communicate with the tubal and ovarian plexus, and the branches into the cervix and the middle rectal plexus. So this is actually the innervation of the whole pelvis right in front of you. Okay. So we will relate this thing with the image also. So you can see T10, 11, 12, and L1, which we just saw in this table. They are giving you the superior hypogastric plexus, then the branches are intercommunicating with the S2, 3, and S4, and then they are supplying the uterus, and they're also giving us the ovarian plexus. So who amongst the candidates wants to read this thing, which is very simple and easy to understand, and it will give you more information about the innervation. And actually the innervation was this much simple, which I have explained you. This is all about the uterine innervation. It's actually a difficult topic for the students, but you should know what to read about it. So let us read this text first, and then I will summarize it for you. So I want Dr. Chaman or Dr. Rita or Dr. Monia or Dr. Maria, anyone who want to read this slide, or Dr. Luzine, Dr. Misbah, anyone who wants to read this slide, just
I
come
can
up.
read.
Yes, please.
Sensory fibers from the uterine body and fundus travel with sympathetic fibers via both the inferior and superior hypogastric plexuses to thoracic cord levels 11 and 12.
Okay,
The two
great.
hypogastric plexuses are continuous with each other by right and left hypogastric nerves on each side of the body. Sensory fibers from the cervix and upper vagina travel via pelvic splanchnic nerves to the S2, S3, and 4, and sensory fibers from the lower vagina and perineum are also distributed to the S2, 3, and 4, but via pudendal nerve.
You can continue.
Motor fibers to the uterine body and fundus are sympathetic in origin, whereas those to the lowest part of the uterus and upper vagina are parasympathetic, traveling via the pelvic splanchnic nerves. Motor fibers to the lower vagina and perineum are somatic fibers, traveling by the pudendal nerves.
Okay, a lot of information which you have already got from your textbooks and in your medical school when you were reading about the innervation of the pelvic organs. So everything is provided in a summary form right in front of you. So what you have to do, you have to just memorize it. So any question comes from the innervation of uterus, you should know superior hypogastric plexus is giving you branches from these, and inferior is giving you branches from these. Sensory is taking part by these, and what is parasympathetic supply and what is sympathetic supply. So let us read more about it. Uterovaginal plexus reach along uterine and vaginal arteries. Okay. Sympathetic are from lower thoracic and L1 and 2. Para are from S2, 3, and 4. Pain afferents are in sympathetic. So paravertebral block is applied in cancer of uterus and labor pains. Okay. Actions of sympathetic: uterine contraction and vasoconstriction. This is achieved by sympathetic pathway. And what is the action of parasympathetic? Uterine inhibition and vasodilation. Inhibition of contractions and dilation is achieved through the parasympathetic supply. Labor pains are due to vasoconstriction leading to ischemia. Referred pain to T11 and 12 segments. Okay. And if we want to summarize it more and more to make it very simple for us, that there are sympathetic nerves, they are T12 to L1, and they cause vasoconstriction and contraction. Why we are talking about uterine contraction? Because this is an important part of labor. Uterine contractions are an important part of labor, so we achieve it through sympathetic nerves, and they are T12 to L1. Then we have these parasympathetic nerves, S2, S3, and S4, and they cause vasodilation. From where this pain sensation is coming for the body of from the body of uterus, sympathetic nerves are taking part in it, and for the cervix, the parasympathetic nerves. Okay, this is the summary for this whole topic. And now, if you have any question regarding the booking, regarding the topic we have just discussed, Dr. Maria, okay, I'm giving you the slide. This one, right? This one you were talking about? Okay, while you are looking at the slide, I can answer the queries also. Yes, Dr. Soud has raised a very important point that the limit of your payment should be at least 2 lakh Pakistani rupees. And the payment, Mafia, have you converted the pounds to the Pakistani rupees? What is the exact amount for today? I think Mafia is taking some time to convert. I can do it. Actually, student, this slide is more important for you to memorize. So if you want to look at this slide, this is the one for you, because this is all you need to know about the innovation of uterus. Two 52. It was 508 pounds, right? If it's 508 pounds for MRCOG-1, it's around 1,28,000. For Pakistan, it's 544. Dr. Nazia, have you checked it correctly? Because previously someone was saying it's 508. Thank you, Dr. Mary. Actually, Dr. Luzine, epidural, the question which you are referring to is another question. The question which you are asking, they are asking about the spinal cord segment in which you introduced the epidural pain relief. Dr. Kadia, you haven't got the eligibility confirmation. You can inquire about it through sending an email to RCOG and just ask them if you are eligible to take the exam, and if not, what could be the reason that they haven't sent you the eligibility. Is it same for Nepal? The fees is not same for all the countries. Let me just check. Let me just check through the RCOG website that what is the fees for Pakistan. If it is 528 pounds, we can just make a calculation again. It's 133. 1,33,000 for Pakistan. Okay. 1,33,000, which my calculator is saying. Thank you, Dr. Sajid. Thank you, Dr. Chaman. So now we can terminate the session if all the queries are done answering. are provided a very good discount for the progressive course. Those who are preparing for the January exam, they can take the progressive course for the good revision. And the progressive course, you should not have to wait till November 20th. You can join now and you will get the recordings of the lectures which were already done in the regular batch. And those recordings are so wonderful to prepare for the exam. And after 20th November, you will be revising everything. Okay. Yes, we're still booking in 2022. Okay, welcome, Dr. Ramna. You just joined and I'm just wrapping up the things that I'm going to terminate the session. You will get the recording now for the whole. What is the discount? Fatma is going to give you the detail of the discount for progressive course. It's 50% off for the students who are already in the regular batch of January 2023. And I guess it's 30% off for the new students. But if you have any problem regarding the payment of the course, you can discuss it with the team. Team is very, very helping and very cooperative for the installments and for the payments. So you just save this number, the course counselor's number, and you can discuss everything about the payment to the team. Thank you, Dr. Saud. Okay, it was really wonderful to have everyone in the free webinar from MedExam, and I hope a lot of queries are now clear for the students. Yes, the team is very cooperative, and I've got a very, very wonderful team of MedExam with me. Okay, if there is any other question, write in the chat box. So students, very, very good, good luck for for all the students and the participants of this webinar who are going to book the exam. I hope the process of booking will be so easy for you. And right after booking the exam, you should be very, very serious. You should be very, very serious in the preparation also. Okay, because if you are, you can see that it's pretty expensive exam. It's an international exam and it's pretty expensive. So for entering into the MRCOG journey, you have to clear this exam. Thank you, Dr. Fatma. So you should be very serious now to pick the books and just start reading all the modules, revise the things, read a lot of SPAs, solve a lot of SPAs, join our study rooms, join the progressive course. You can take the installments also, and you have got the discount already. So just go for it, okay? Okay, team, we are now going to terminate the session. I guess there are no more queries. And if there is any query, you can post it in our guide groups, the Telegram and the Facebook, and all the team is available there for answering your query. Yes, Dr. Selma, you will get another email for the booking, and you have to wait till tomorrow. You will get the booking email, the booking token tomorrow. I would say a special thanks to Dr. Manisha and Dr. Mustafa, who were our old students, and Dr. Vaishnavi, who attended the session and answered the queries of the students. Thank you, Dr. Mustafa, for taking part in the question answer session. And the help you provided was very beneficial for me, for the team, and for the students. Thank you so much. Doctor, you can get the Telegram link. Thank you, Dr. Farzana. Fatma, please share the link of Telegram group here. So you can just go to Telegram and write MedExam MRCOG-1 guide group, and the group will be right in front of you. That's a big group. Thank you, Dr. Zimal. Thank you. Thank you, Dr. Ruhi. Thank you, Dr. Tehrina. Actually, we're going to have another free webinar on 15th of November, in which we will be talking about how you can start the preparation for July exam. So anyone amongst the students who is not taking January is going to take July attempt, he can attend that session. And again, we will discuss some questions, some educational questions. Thank you, Dr. Abdullah. So what we will do in that session, we will try to I will try to give you an orientation for the preparation of July exam, and that's also very important webinar to take. Now is the time to say you bye bye, and we will cover all the queries in our guide group now. Okay, bye bye.